Hi, I'm Dr. Fox. Let's talk about renal fascial spaces. In this video, we'll discuss the relative positions of the kidneys within the retroperitoneal space, with an emphasis on both the perirenal and pararenal fascial spaces. So first, let's look at the kidneys in situ. So for us to appreciate this anterior view of the urinary system, we would first have to do quite a bit of dissection. So the anterior and lateral thoracic wall has been removed. The lateral and anterior abdominal wall has been incised and reflected downward. And all of the organs of the digestive system have been completely removed. And we have gone through the parietal peritoneum of the posterior body wall. The result is this view, and we can see the structures of the retroperitoneum. In particular, we can see a left kidney and a right kidney, and we can see how they are sitting lateral to the vertebral column as well as the aorta and vena cava. So the left kidney tends to sit a little higher than the right kidney, and there's the left and the right kidney. They're not in this particular photograph, but typically the superior pole of the left kidney is sitting a little higher, and that's owed to the fact that the liver occupies so much space in this right upper quadrant. So we look to the hyla of the kidneys, and they are about at the level of the L1 or first lumbar vertebra. We call this the transpyloric plane. The transpyloric plane aligns with where the stomach, the pyloric part of the stomach, comes down, and it begins to feed into the duodenum, which is the first part of the small intestine. So we can see this plane running through there. We say that the kidneys are in the paravertebral gutter because the bodies of the vertebrae are sitting there and they're sitting lateral to it. And so there are these spaces that are kind of like scoops that we'll see better in an upcoming image. So they're in this paravertebral gutter, and their hyla are situated anteromedially. So we have this, this notion that the hilum of the kidney is facing perfectly medially, but in fact, the hyla is anteromedial, so slightly anterior and slightly medial. And that's a consequence of sitting in this paravertebral gutter. What's also interesting is that the kidneys may change position slightly as the diaphragm contracts during ventilation. So if the diaphragm is on the move, or sometimes if an individual is upright versus lying down, they can shift slightly despite being surrounded by copious amounts of adipose tissue, which we'll see. So let's take a look at that retroperitoneal space, and let me give you an idea of what it is we're looking at. So this is an inferior view of the right side of the transpyloric plane. So we've taken a transverse slice here. The midline is right about there. And so right is there. We can see the liver there. I can see the inferior vena cava there. I can see the abdominal aorta there. And so we are looking at a right kidney. So the abdominal pelvic cavity is lined by a serous membrane called the peritoneum. Like all serous membranes, there are visceral components and there are parietal components. So for instance, in this illustration, there would be a visceral peritoneum adhered to this liver, and then a parietal peritoneum on the body wall here, and there would be a peritoneal cavity between these two that I can shade in green here. Anything behind this parietal peritoneum here we refer to as the retroperitoneum. That retroperitoneum can be divided into a number of spaces. Specifically, when we're dealing with the kidneys, we think of the renal fascial spaces. And so let's start with the kidney itself. So the kidney is located here, and it is surrounded by renal fascia. So this renal fascia, or perirenal fascia, it's referred to both ways, surrounds the kidney, the suprarenal glands, the ureter, as well as a copious amount of adipose tissue that we call perirenal, peri with an I because it's inside the renal fascia, fat. And this is the perirenal space. You can conceptualize this kind of like an inverted cone, with the base of the cone being just above the suprarenal gland and a tapering down following the ureter towards the pelvic cavity. Now, outside of that renal fascia, or perirenal fascia, there are pararenal, para with an A, spaces. There's an anterior pararenal space and a posterior pararenal space that help to also surround the renal fascia to help fill that space, protect it, buffer it from any jarring blows, and to allow any neurovasculature to move through it. Now, sometimes, if an individual were to suffer or enjoy, depending on your perspective, rapid weight loss, what can happen is that perirenal fat can quickly go away, and that can weaken the integrity of the anchor of the kidney. And so a kidney can then drop. That's a condition called nephroptosis. And with nephroptosis, any of the vasculature that enters into the hilum can kink when that drops. And so like a garden hose can kink, that can endanger the blood vasculature to the kidney. It can endanger the ureter exiting the kidney. And so it can be painful and have physiological and physical consequences. Oftentimes, nephroptosis symptoms are going to dissipate when an individual lies flat. And that's because gravity isn't pulling the kidney inferiorly. So we've discussed the relative positions of the kidneys, as well as their position within the retroperitoneal space. And we've discussed the surrounding perirenal and pararenal spaces and their contents. Thank you so much for your time. I'll talk to you in the next video.